et cetera. But I wanted to emphasize we're continuing to remain at a high level of disease transmission in Washoe County. Our 7-day rolling average is at about 72. It's been remaining above 70. And so this is a cause for concern and for people to continue to be vigilant in wearing masks, social distancing, washing hands, et cetera. A reminder that what we've seen previously, as we've experienced peaks, and we get a little decline, and then we flatten out to a new higher plateau level, and that's what we're seeing right now. So the concern is if we don't continue to be vigilant and work to curb the spread of this disease, that we will from here rise to an even higher peak in the future. So we really need everyone in the community pulling together to keep us moving downward rather than flattening out and potentially going up again. I wanted to make some comments on our testing that we're doing. We have been operating our post and 5 days a week. We have been working with Charles River Lab, and they're now doing the analysis of the specimens we collect a couple of days a week. And so that's helping with turnaround time on lab results, having another local lab resource available. Renown has also has a lab established for running the COVID-19 testing, and that's also increasing turnaround times, decreasing turnaround times, increasing performance for our community, and they're continuing to work to add additional capacity to that lab. This weekend, we will have alteration of how we do the scheduling for testing for people that want to come through our drive-through post next week. And that's because the Acela permitting and licensing platform that the region uses, Washoe County, Reno, and Sparks, for our permitting and business licensing, is going to be moving from one location in the cloud to another one as far as the servers that are being used. And we also use Acela for our risk assessment and scheduling process for people getting signed up for testing at the post. So that system will be down from late Friday afternoon through the weekend. And so that will impact the way we're able to work to get people scheduled. So my recommendation, and if you could help to communicate this to the community, is if people are seeking to get tested for COVID-19, please try to do that before 3 o'clock on Friday afternoon. That's Friday, August 28th, because after that we'll have a manual system. Over the weekend, if you need to be tested, you can still dial our 328-2427 number, and we can work with you to do the risk assessment and to get scheduled for testing. We have had an automated process where people could go in and reserve a time slot to be tested. That will all need to be done over the phone. So we'll have additional staffing on board over the weekend for people that are seeking testing over that period. So again, if you have the opportunity and want to be tested, please try to do that before 3 o'clock Friday afternoon. It will be more, not as quite as streamlined for you if you do that over the weekend. We will operate the post on Monday, and then we will operate the post again on Wednesday, Thursday, and Friday next week. So we're scheduling people manually over the weekend for the Monday testing. We'll be doing some catch up as we get Acela back online, and we'll resume our post testing again Wednesday next week, and we'll continue Wednesday, Thursday, Friday. What we've seen recently has been that there's been less demand for testing through our drive-through post. So we've had plenty of capacity available. So I also wanted to emphasize that to everybody, as well as that there's no cost for getting tested if you use the health district and come through our post. We don't ask you questions about your health insurance or immigration status, et cetera. So it's a very easy and streamlined process for free testing through the post. I think everybody saw that the state of Nevada has launched a digital contact tracing app that people can use on their phones to be able to have an automated system of identifying other people's cell phones that you've been in close contact with, which would allow you to be notified if one of the people that owns one of those phones is diagnosed as a positive COVID case. And so that's a free app that's available through the contact tracing app. And it's available if you go through the state's, more information through the state's Nevada Health Response site. And it's also available through the Apple and Android app stores. So we just wanted to highlight that new resource that's available. With that, I'd open it up to any questions people have.
All right, go ahead, guys, and fire away with questions. If you want to leave one in the chat box, I can relay that one as well. But please feel free, go ahead.
This is Siobhan from the Reno Gazette-Journal. Hi, Kevin. So some of the school cases reported, I know you don't want to get into specifics about what's happening at schools, but overall, are students going to school who are waiting for a test? Has that happened?
So thank you, Siobhan, for the question. I think maybe you're asking if people are going to school while they're awaiting results from a test.
Yes.
Yeah, and we have had that occur, and so appreciate that question, because our recommendation would be for anybody that has received a test to remain home while you're awaiting those test results. If you felt like it was important to get a test, then we feel that that's important to wait to understand whether you're positive or not before you resume normal activities. So if you can help with spreading that message, if people are getting tested, they shouldn't be going back to school. They should be waiting for the results of those tests.
How is that happening? They don't know that, or they just don't think they're sick, or what were the cases that we've seen kind of in the last week?
I'm afraid I don't have the details to be able to answer that for you, Siobhan.
Okay.
Hi, Shaditi from This Is Reno. My question is, you mentioned that regardless of immigration status, people shouldn't be worried about getting tested. Has the district seen any situation or example of people willingly not going to get tested because they are concerned about their immigration status and they are scared that they might be arrested or reported?
Thanks for the question, Steve. I don't know that we have that information directly, but I mentioned that because I have heard that those concerns that exist in our community. So I wanted to address that based on the rumors and what I've heard is occurring to make sure people understand they don't need to have that fear as far as coming through and getting tested through our post.
Speaking of rumor, there is another that I've recently heard, that when people are making interstate travels, especially if they're coming from California or New York City to Nevada, they are basically paying off a healthcare practitioner to certify them as COVID negative. Have you come across any rumor of that sort?
I don't know. I'm not aware of that rumor specifically. But I would remind everyone, as far as any certification of somebody as COVID negative, that only is for the moment that a specimen was collected for testing. And so we should all understand that if somebody has been in contact with somebody that has COVID-19, if they're a close contact and they've been notified of that, there's a 14-day quarantine period for them because that's the period that they remain infectious or they could be infected. That's the incubation period if they've been exposed to somebody that is infected. And so during that 14 days, if somebody is tested and they get a negative result, that doesn't mean their quarantine is over. They would still need to continue through that 14-day quarantine period because they might still have the virus in their system and it just hasn't multiplied to the point that it's found on the test and has infected them.
Okay, and the last question, and this one's about the app. So about the COVID tracking app, I know that across the world, people have expressed concerns about surveillance. So what's your take on this? I know that it's important for people to be aware of the app and to be using it for the greater good. At the same time, what are the risks? And does the benefit trump the risk? And if yes, then how?
So this is an app that the state of Nevada has worked to provide for our citizens. And so I'm a kind of a layer removed from the work that was done between the state and the app developer and provider. But my understanding is that there was a lot of attention that was paid to protecting the privacy and security of people that are using the app, and that it is set up in a way where they're not being tracked. Their phone is storing information about the phones that they've been near, and those phones have information about the ones that have been near them. And it's that information that's used to notify somebody whose phone was near a person who was tested and found positive for COVID-19.
Okay, and was this created by Deloitte? Is this connected with the Salesforce that we talked about before?
No, no. My understanding is this is completely separate from the Deloitte and Salesforce process.
Okay, thank you so much.
Yeah, and as far as the benefit that you'd asked in your question, the benefit would be if you were in close contact with somebody, and the criteria that we use is within 6 feet and over a period of 15 minutes. When we do the disease investigation, with the person that tested positive, we're doing our best to work with them to try to recall everybody that they were in contact with during the period that they were infectious. But it's sometimes people can't remember everybody that they talked to over a several day period. And so if you were one of those people they couldn't remember, you would be able to find out that you were in close contact with that person. Or if you were in a setting where there were other people that you were near for a number of minutes and they may not know you and you don't know them, it would also provide you with that information that you'd been near an infectious person that we wouldn't discover through a disease investigation.
Thank you very much.
Hi, Kevin. It's Anjanette.
Paul Nelson with 2 News.
Oh, go ahead.
Go ahead, Anjanette.
Oh, thank you. I understand that the CDC has apparently changed its testing guidelines to recommend against testing people without symptoms, even those who have come into close contact with a positive case. Is the health district changing their screening criteria for determining who gets a test?
I don't believe that we've changed anything in our risk assessment process as far as the screening for who gets a test. But I think that the reason that the CDC changed that criteria may be tied to the point that I made a few minutes ago, that if you are a close contact and you're in that 14-day quarantine period, if you get a test and it says that you're negative, that doesn't mean that you can get out of quarantine. You still need to be in that 14-day quarantine period. And I believe that the negative test results may be creating confusion for some people and have them thinking that they're okay and don't need to be quarantined.
This is Paul Nelson with 2 News. Overall, how pleased are you with the way the trends are looking right now, and do you think that it's a result of the mitigation efforts that they might be working?
Yeah, thanks, Paul. I think at least our trends have come down somewhat. I'm hopeful that what we're seeing is the result of the mandate on masks and more people that are complying with the mask requirements when they're out and about. But as I mentioned, I'm not satisfied that we're remaining flat at the levels that we're at right now. With our average of new cases remaining at over 70 per day, that's still unacceptably high, and we need to continue to work to try to drive those numbers down for the health of our community.
This is Megan Mufferly at the Nevada Independent. Just jumping off of that last question, I mean, looking at the numbers, it does look like kind of a plateau in Washoe County. And then statewide, we've seen decreases, which is mostly influenced by the decreasing new cases reported each day in Clark County. I'm wondering if there's any speculation you have or analysis of maybe why cases are decreasing in Clark County and maybe plateauing in Washoe County.
You know, I don't really have a good theory for you on that, Megan. You know, we know that Clark County had a significantly higher number of cases per capita that were occurring than we did have here in Washoe County. And so they may have had a lot of transmission that occurred with people that were engaged in riskier behaviors, and maybe they're through a little wave of that. And moving down, but you know, that's just speculation. I think we felt that Washoe County has been a few weeks behind where Clark County has been kind of through the period of COVID-19 to date. And so that may be a factor in that as well. But I think what we need to really focus on is Washoe County. That's where we're at. That's where we live. And we really need to work to get off of that plateau and get on a downward slope of continued decrease in cases.
This is Siobhan again from the Reno Gazette. How is contact tracing going with the school district and even UNR? How do you feel it's going so far?
I guess I don't think I have enough experience with UNR to date, with them just getting going earlier this week. I do know we're coordinating quite closely with their student health services and have a real good working relationship with them. With the school district, we have devoted staff to be able to identify pediatric cases as we get new positives coming in from testing. And so we're trying we are expediting the identification of pediatric positive cases and the disease investigation around those, so that we can work quickly to try and exclude students from school if they've been in close contact with those individuals, and do that in a manner by acting quickly to hopefully prevent disruption to the extent that we can with classrooms and the schools in that process.
I know we've had like 11 schools report cases, and with the delay in testing, any estimate of how many more schools you may need to look at, but we're still waiting for results that will be, 3 to 5 days from now? Are there quite a few more schools that you suspect may have cases?
I don't know that we have any information on schools that we suspect may have cases. We're reacting as we get the positive results back. I think that the good news is that with the testing that's occurring, we're seeing that 2 to 3 day turnaround time is becoming, the most prevalent for test results that are happening locally. And I think even LabCorp is providing us with pretty good results for the testing that's being shipped to commercial labs as well.
When do you think, and I'll ask another one since no one jumped in, when do you think we'll see the results, or, when do you anticipate, like in 2 to 3 weeks, we would see the results of schools opening and UNR opening? When's kind of like the D-Day, or the day that how far in could we see a jump? What would it take?
Yeah, I think Shaban, that you've been engaged with this enough, and talking with me, that you've got that time frame probably about right. I think 2, maybe 3 weeks is when I would expect we might be seeing some impacts, if we're going to be seeing those.
Any other questions for Kevin Dick?
I mean, we're only 5 days into really having school because of smoke. Would you still say they should be closed based on our data?
That remains my recommendation, based on the level of disease transmission that we have in our community, and the work that's been done by others, so that are much smarter than me as far as recommendations for schools on what are the criteria that they should be using for reopening.
This is Paul Nelson with 2 News again. I might have missed this if you mentioned it earlier on. I was having some technical problems over here, but we know that CVS is now offering the flu shot to people. How important is it for people to get the flu shot this year with COVID-19 happening at the same time?
Yeah, thanks for that question, Paul. You didn't miss that. I hadn't addressed that, but it's a very important question. And it's very important that people get the flu shot this year. We know that that flu every year sends many people to the hospital that sadly become gravely ill with the flu. We can have tens of thousands of people that die on an annual basis with the flu. And so it's part of what we need to do to help to preserve our healthcare capacity and keep our hospitals from getting overwhelmed. We're expecting, as always, that we're going to have flu cases with flu season coming up. We're also expecting we're going to have increased cases of COVID-19 as we get into the viral respiratory disease season. Also, because flu has the same symptoms, or many of the same symptoms of COVID-19, if we have people that are becoming ill with the flu, they also may impact the testing capacity that we have for COVID-19 testing, because they may well then be getting tested for COVID-19 to try to rule out that that's not what they have. So to the extent that people can get their flu shot this year, one that will protect them from getting the flu, and if they get the flu, it should not be as severe as if they hadn't gotten the flu shot. And 2, it can also protect them from having the anxiety of whether they have COVID-19 and having to go through the COVID-19 testing process by avoiding getting the flu. And then I think the third scenario is the bleakest, is the potential health consequences if somebody does contract the flu and then they get COVID-19 on top of that. And we know that if people are suffering from the flu, that reduces their resistance to having other diseases. And it's often those other diseases that are the complications that lead to the fatalities. So it's just all around a good idea to get the flu vaccine this year. We'll be also ramping up our efforts to provide flu vaccine. I encourage people to go to their pharmacies, to their doctors, to use their healthcare plans to get the flu vaccine. But we'll also be next month beginning to provide some drive-through pods for people to be able to get the flu vaccine as well.
Is the flu already here? Someone told me that they already saw some cases of the flu. Sorry to jump in again. I'm just curious. It's not school related. Is the
Yeah,
flu, have you seen cases of the flu already?
I have not heard that we have flu cases, but that doesn't mean that that's not an accurate report. I'm just not in the loop on whether we've seen any flu yet. It's not, it's not the flu season quite yet, but yeah, it doesn't mean that we don't have a few isolated cases out there.
Hey, Kevin, it's Kenzie with News 4. Might be a silly question. Is it ever too early to get the flu shot?
Well, I think the flu vaccine is just coming in, and so I know it's available in some places. It's too early if you're going to get the shot before the vaccine for the current season is available, because they changed the flu strains that are in those shots. It does wane over time. But my recommendation would be, if you can get it, go ahead and get it. It's much better to get it and avoid getting one of the early flu bugs in the season than waiting and getting the flu because you waited too long to get the shot.
Kevin, Frank Mullen with the Reno News and Review. I also arrived late, so you may have spoken to this, but do you anticipate any increase in cases with these students coming back to UNR from various points in the country?
Yeah, I would expect to see cases that are coming out of UNR resuming classes. I think they've been working quite hard on how they're trying to maintain social distancing and reduce the spread of disease. But just having thousands of people coming together on the campus and that increased interaction would be expected to contribute to additional cases occurring.
All right, any other questions? All right, hearing none, that'll wrap it up. Just as a reminder, if you want to watch these press briefings, you can watch all of them. If you go to COVID-19washoe.com and hover over the press button, and there's a press conferences page where you can see all of these press briefings that we've had. If you have any questions, feel free to reach out to me. Otherwise, have a great week, and thanks for joining us.